An East Texas woman is only 52, but she needs a pacemaker to maintain a normal heart rhythm. Her teenage granddaughter is now changing her own life to avoid the same fate. As KLTV7's April Peardant tells us, millions of Americans are silently developing the same disease.
You have like heart problems, like with breathing sometimes.
Many, like Faith's 52-year-old grandmother, have experienced heart problems.
She got like a pacemaker,
a device that regulates the heart's rhythm.
She still like get pain sometimes in her heart.
According to National Institutes of Health, approximately 3 million people in the United States live with a pacemaker.
We have made a lot of advances in technologies and treatment.
Dr. Oscar Paniagua is a cardiologist at Christus Mother Frances Hospital. He says prevention is still a problem.
Heart disease presents typically with chest pressure and tightness, but there are some atypical presentations, especially in women.
Sometimes all these symptoms can mimic a heart attack and are often not detected or often missed.
It's important to be aware of that for early detection of a heart attack.
Dr. Nitin Kondamudi treats heart patients at UT Health. He says the disease doesn't discriminate.
Certainly based on location, for example, rural America is going to have a more difficult time getting access to the regular health care that they need.
Many people develop cardiovascular disease silently for years.
Even when you feel okay, it's important to make sure you have constant contact with the doctor because something can be brewing and you would never know it until it's too late.
The key message, early detection helps prevention.
That's what we are doing this month with it. Focusing on that.
Faith knows she can't change her grandmother's diagnosis, but she can change her own future. And doctors say that starts now. April Peardant, KLTV 7 News.
Annual doctor's checkups are recommended for everyone, possibly even more often if you're at a higher risk for developing heart disease.